Good afternoon, wonderful viewers. This is your weekly routine health talk show. I am your host Ahmad Abdullah Jaju. This is what we do to select priority topic, or we can say prevailing conditions, to come and teach you as far as primary health is concerned, or disease prevention and health promotion is concerned. So I'm happy. Also, I am honored to have personnel, my panelists, and then I welcome you once again. And then before making any proceedings, I would like to introduce it to you that the selected topic of discussion today is glaucoma. So I would like, before going further, to ask my boss lady beside me here and the gentleman to introduce themselves to the wonderful viewers so that people can know exactly who they are. From the boss lady.
Good afternoon, viewers. I am Fatmata Kasama. I am an eye specialist. I am also the founder and coordinator of Eye Care for All. This is a charity organization that provides free home-based and community eye care services for the less privileged, especially those in rural communities, the elderly people who cannot easily go to the hospital, people with disabilities, refugees, prisoners, and everybody in the Gambia who needs eye care services and they cannot afford it.
Thank you very much and welcome you once again. And then to the gentleman beside me.
Okay, so good afternoon, everyone. My name is Lamin OBI. I'm a final year medical student at the University of the Gambia, and I'm one of your panelists here, and we'll be talking about glaucoma today.
Okay, thank you very much. And then wonderful listeners, to remind you again, the selected topic of discussion is glaucoma. Glaucoma, we can say, is a major public health problem because glaucoma is one of the conditions that is causing most cases of blindness we can say worldwide, is because this is beyond regional. So, but before going explaining this to you, I will select personnel who specialize in this area to explain it to you, to buttress more, to give you facts about glaucoma. So I will start it from the boss lady beside me to tell us what is glaucoma.
Thank you very much, Jaju. So before I go to the details about glaucoma, I would just like to highlight that we are celebrating World Glaucoma Week. So every year from the 8th to the 14th of March, eye health workers and glaucoma associations all over the world come together to celebrate World Glaucoma Week. So the objective of this celebration is to raise awareness in the community, to tell people what is glaucoma, what causes glaucoma, how they can prevent glaucoma, because it causes irreversible blindness.
Oh yeah.
So as Eye Care for All, every year we try to raise awareness in the community and also do free eye checkups. But this year we want to focus on TV programs and radio programs, because this is the area we can reach majority of people in the Gambia. So glaucoma, it's an eye disorder that has different characteristics.
Okay.
So one of the characteristics, it's raised intraocular pressure. You have optic nerve damages. Then you have poor vision or loss of vision, which can lead to permanent blindness. So glaucoma is something that anybody can get. So there is no direct causative factor that you say. Example, if when it comes to malaria, you say you are bitten by an infected mosquito, you have malaria. So glaucoma does not have all those causes. It just have predisposing factors and risk factors that can cause glaucoma.
Yeah, thank you very much. That is very clear, and also, and then that information is very important to inform people out there. We are commemorating World Glaucoma Day from 8 to 14, just to empower people, to enlighten them, to strengthen them in as far as disease prevention and health promotion is concerned. Thank you very much for that wonderful information. And then to the gentleman, do we have any possible signs and symptoms of glaucoma?
So the signs and symptoms depend on the type of glaucoma it is. So it's basically divided into a congenital type, that someone develops glaucoma as they are born, and it's associated with various other syndromes. And there's an acquired type that happens as you grow older. So with the acquired type, usually they may not present with any pain, any symptoms. They just start losing their vision progressively. They start losing their vision, and then usually it starts from the peripheries. So they cannot see like this, and it goes over a prolonged period, could be from 15 to over 70 years. Their vision starts going down a bit. So that's the most common presentation.
Yeah.
Also, you see with these people, when they're losing their peripheral vision, you can see someone walking and hitting an object. It's not that he has a problem, it's because he's losing the peripheral fields.
Yeah.
So that is the sight from outside to inside.
Yeah.
So with the acquired type, there are two main types, three main types, the primary and the secondary. So primary is usually due to causes that are not known, and secondary are due to some other causes like diabetes, like hypertension.
Yeah, okay.
So with the primary one, there's one which is that goes more into the pathophysiology.
Yeah, okay,
That is the primary open angle glaucoma and the closed angle glaucoma.
Yeah.
So with the open angle glaucoma, it usually doesn't present with any symptoms. But with the closed angle type, there's a variant of it called the acute closed angle glaucoma. That's the one which presents with very severe symptoms at once and leads to blindness at a very fast rate. But luckily for us, that is less common than the primary open angle glaucoma.
Yeah.
And I think that is where our discussion will be focused on today.
Yeah. Thank you very much. Madam, will you like to add more on the signs and symptoms of glaucoma?
Before going to the signs and symptoms, I would just like to explain the pathophysiology so people understand better.
No problem.
So in the eye, we have what we call the ciliary bodies. So the ciliary bodies produce aqueous humor. And we have, aqueous humor.
Yeah, okay, the fluid-like.
Yeah, the aqueous humor, it's found in the anterior chamber. And the anterior chamber gives shape to the anterior part of the eye.
Yeah.
So when aqueous fluid is produced by the ciliary body, it has to drain through the trabecular meshwork. Okay. So if there is any blockage through that meshwork, the pressure goes up. So when the pressure goes up, that is what damages the nerves. Yeah. So if the nerves get damaged, that is where you get poor vision, or that is where you get start losing your vision. Okay. So I would just add to what he said when it comes to the different types and signs and symptoms.
Yeah.
So we have different types of glaucoma. We have congenital glaucoma. This affects newborn babies, as the name congenital, they are born with it. So one of the main signs that can manifest is the baby will have megalocornea. You see this black part of the eye, so it's so big when you compare it to other babies. Okay. And the baby will have photophobia. He or she will not want to
fear.
No, the baby will not want light to touch the eye, either bright light or sunlight. And then there will be a lot of tearing from the eye. Yeah. So they'll become very irritable. So this is not curable, but it's treatable. Okay. So we also have primary open angle glaucoma, as he mentioned. So with primary open angle glaucoma, you have the angle is open. There is no blockage in the angle, so the aqueous is produced and drained. So when there is any imbalance between the aqueous production and the aqueous drainage, that is where you have the high pressure. So with primary open angle glaucoma, the aqueous production and drainage is not affected. So the aqueous is produced and it is drained correctly. That is why it's called primary open angle. In there, the angle is not blocked. Yeah. So with that, the pressure can be high. You can have nerve damages and then vision loss. Like he said, it can take 5, 10 to 20 years before the individual will manifest total loss of vision. Yeah. You also have primary angle closure glaucoma. This is where the angle is blocked. It could be due to different things. So you can have, if you have cataracts, you don't operate it, the cataract become hypermature, the cataract can block that angle. So aqueous production and drainage will be affected. So the amount of aqueous produced will not be drained equally. So there the pressure goes up and then the nerves will be damaged. So you can also have inflammatory diseases like uveitis. So when those things happen, it can block the angle. You can also have injuries. When you have injuries, let's say in the communities you have penetrating eye injuries. It could be stick, pencil, or knife. If it affects the ciliary bodies or it tampers with the drainage system, you can have differences in aqueous drainage and production and drainage. So all these things manifest different signs and symptoms. Unless you examine, you cannot. So you can do gonioscopy. This is an assessment that is done to see if the angle is open or closed. But simple assessments like IOP can test if the IOP, that is the intraocular pressure in the eye. The eye is high or low. So when you do that, you can know if the angle is closed or open. And then from there, you can, patients usually manifest with different problems, like before I'll just mention that we also have another type of glaucoma where the pressure is not high, normal tension glaucoma, where you will check the pressure is normal, but still the patient will have nerve damages and the patient will have poor vision or loss of vision. Okay. So patients can manifest with severe pain, headache and nausea. When it comes to acute angle closure glaucoma, like he said, some patients can be in severe pain. I think since my practice over 5 years, I only saw that case once. Yeah, usually in that you put them on diuretics. You give them mannitol IV, so that the pressure can go down, and you also give them Diamox to bring the pressure down. Because the patients would be so irritable, you know, they can even lie down crying. But with the normal angle, normal tension glaucoma, with the angle closure and the open angle glaucoma, patients come with high pressure. They come with nerve damages. These are things that you have to examine and tell them. But they cannot see. But one thing he mentioned, which is very important, is that the patient will lose vision. He or she will not be aware. And then the major signs and symptoms that I want everybody to look at and observe is when you are walking, because you have peripheral loss of vision, when you are walking, you start hitting objects in the peripheries from the side. So when you notice that in yourself or in someone, no, don't just blame them that they are just walking and hitting things. Know that they don't have the side peripheral vision, it's damaged. That is what happened. So let me just talk about the
no problem. You can go ahead.
Pathophysiology,
this is all we need.
How it happened. So I came with this just so that people will really understand when we talk about glaucoma and how serious the condition is. So when you look at this image, you can see the disc you have. It's pink. You have the blood vessels all over. You can only see a small portion that is pale. That is pale, like yellowish. So when you come here, you can see a very large area. With small nerves. So this thing, red thing you are seeing here, it's the optic nerves. So this is the disc. So when you look at an eye that has that does not have any problem, it looks like this. But an eye that has advanced glaucoma, which means most of the nerves are damaged, like 90% to you can say 95% of the nerves are damaged. It looks like this. So what happens is, in an eye that has glaucoma, if the pressure goes up, the pressure damages these nerves. See all these nerves here, the pressure will damage them. Nerves will die. Because when you look at an object, the eye just only looks at an object. So it sends the the nerves in the eye, the optic nerve, that send the information to the brain to be translated. So when those nerves die, you'll be looking at an object, but you will not see. So that is what happens in glaucoma. Even somebody has advanced glaucoma, all the nerves die, they are damaged. The person will be looking at you or looking at objects, they will not see anything. So in certain instance, people will say, the person is looking at me. But he pretended he did not see me. Or but the fact is the person is not seeing you. The person is looking, but he is not seeing, because the nerves are damaged. Because the nerves are the most important thing when it comes to glaucoma. So when the intraocular pressure goes up, it damages the nerves. So as the pressure goes up, the nerves are damaged, little by little. So this can take over 10, 15 to 20 years. So before you know, the nerves are all damaged. So most of the time, people present to the hospital very late. By the time they get to the hospital, when you observe, it's either you have 75% to 90% nerve damage. So when you do fluoroscopy, usually you check the pressure, you dilate their eyes. I'm sure those who have eyes have been dilated before will tell you. They'll just put eye drop in your eye and ask you to close your eyes and sit for a while. Then after some time, they just use an ophthalmoscope to look, because the window of the eye, it's dilated. That is the pupil, so that they can the one examining can see,
can have access to see.
With the nerves, they can see the blood vessels, the retina, if there are. So with that examination alone, you can tell if a patient has diabetics, hypertension, sickle cell, HIV and AIDS.
From that examination?
Yes. Just
this is interesting.
Looking at, with the eye, you can diagnose so many patients.
Yeah.
Even from the anterior to the posterior. Even patients who have immunosuppression, HIV, you can diagnose by examination.
Then this is very serious. I think
so the eye is very important.
We need to advise a lot of people out there to go for an eye examination where you can have multiple diagnoses from a single examination.
Yes.
This is very important. And then do you want to add?
Yes, so
yeah.
Just to complete this part, so a normal eye, when someone with a normal eye, the disc, it's okay.
Yes.
So when the person, now this is the eye.
Yeah.
The optic disc is okay.
Yes.
When the person looks at an object or image, everything here is clear.
It's clear.
So this means this person's eye, it's okay.
It's okay.
So in this person's eye, the person has advanced glaucoma. All the nerves are damaged.
Yeah.
So when the person looks at an object, this is all what he can see. Or you see all this part that is dark?
Yeah.
It means the person is not seeing all this area.
Tunnel vision.
Tunnel vision, because the nerves that are supplying this part of the eye has been damaged.
Sideways.
So the only nerve that is left is the one supplying this part. So if these other nerves are all damaged, everything here will be dark.
Yes.
So that means by looking at this eye, you can't tell whether
so meaning by looking,
you cannot tell.
You cannot tell.
You must
unless you go for an examination.
Yeah.
Yeah.
So that is it. With these two eyes, you cannot tell who has glaucoma or not.
No.
But when you do an examination, you will know that this person is looking, but she is not seeing.
Yeah.
So this person is seeing because the disc is okay.
Yeah.
So yeah.
I think this is very clear. Oh, you would like to add?
Just to add onto that, sometimes you can have unilateral damage of the eye. Only one eye is affected, and then the other eye is normal on the examination.
Okay.
And it's very important because the only symptom in most cases is progressive loss of vision.
Yeah.
So this is important for many skills that are out there, many jobs that are out there. For example, a driver can be driving and then not seeing the side of the car. So the driver is just seeing in front. There might be someone coming, and then you don't really know what who is coming and what is coming. That's why it's important that
for everyone,
eye examinations be done almost every year.
Yeah.
At least every year to see if there's any condition, whether it's in the eye or systemic.
Okay.
Because what she explained, the eye is a gateway into the body. The eye is one of the structures in which, from examination outside, you can see the blood vessels inside, you can see the nerves.
Yeah.
So any damage that affects those blood vessels or nerves can be detected by the eye. That's why diabetes, hypertension, in very advanced settings, most of the patients who are referred to the clinical area come from the ophthalmology department.
Yeah.
So that's why some people say they're just studying the eye, it's just a little thing, but it's the window to the soul. It's a window to all the conditions that we have. Almost all of them can be diagnosed through the eye. That's why it's important that ocular examinations are done, and they are done frequently,
regularly,
almost every year. And we are lucky in the Gambia here that we have a very advanced center that is renowned throughout the sub-region for the treatment of the diseases of the eye. So everyone can just go there at least once a year and have your eye checked.
I think this is very important. This is why we are here sitting. Primary prevention is the best because it's better you prevent yourself than to spend money for curative activities and stuff. So this is why we are here, to teach them, to empower them to have a clear, picture or maybe understanding towards disease prevention and health promotion. And then badingolu binala le nyato damading binala kajin kacha kumbinti olong glaucoma te mandingkol ka fa ko wulen jim fincho komi mari nyakata malaring bara mari abukeje adung jibero to ibuka long ko tonya mari afincitale isa nyillon no nya dila foni katata doku lalla mini buko nyini be nyamin ebe doku la damin wollon dulalti min yalon ko wolla ka senendiro keno la because momo nala mechola momo mechitio min buko loptan doku la wolla sa suteno because do jorangol be bulle ka mini tamande pour kete mari wiste so be kacha kalen angale la bari mangta binamuru na kachale kacha kum mindi wolong wulen dim fincoti tubabol ka fa ko glaucoma. On that note, we will proceed to the risk factors. Do we have any possible risk factors for glaucoma?
You want this in English or Mandinka?
Yeah, anyway, you can choose whatever.
Okay, so I will just say in both. So the risk factors of glaucoma, when you have age, so anybody 40 years above is at a higher risk of glaucoma. However, everybody can have glaucoma. So you will not say, I'm not 40 years or I'm less than 40 years, so I cannot have glaucoma.
Even babies.
Anybody can have. Babies are born with glaucoma. So anybody can have glaucoma.
No exception.
No one is exception.
Trust me. This
so
is
we also have African, the race.
the race.
So as black, I read a couple of researches. It stated that our gene predisposes us to glaucoma. Yeah. And then we also have people with hypertension, diabetes. They are also at a higher risk of glaucoma. Yeah. So stress is also a risk factor for glaucoma. Like I said, we don't have direct causative factors, but we have risk factors that can predispose people to glaucoma.
I think just to add, another risk factors are the increased IOP. And also people who use steroids for long. That's optical steroids. Prolonged use can also predispose you to glaucoma. And
thank you for raising that issue. So one thing in the Gambia, people just walk into any pharmacy to buy.
This is important.
And it's not everybody who works in the pharmacy is a doctor, nurse, or a pharmacist.
Even knows how the drug works.
This is why I say. This is why last time I said drugs are not candies. You know, for candies you can go and buy without any instruction, you consume them. But for drugs you need a personnel who is trained to explain it to you, and in fact that explanation they will tell you the indications and also contraindications. I think this is very clear. You can tell the wonderful listeners that, you know, you just don't buy drugs like that.
So when working in the eye hospital, we've seen a lot of cases. People just walk into any pharmacy, buy drugs and use. When things did not work, or when they have complications, that is when they come to the hospital. Because nobody wants to go to the hospital. So one thing I would say is please don't go to the pharmacy and buy eye drops or any other drops. Get your prescription first, get your laboratory test, or get prescription. That is the most important.
Prescription
from a specialist or someone who is licensed and qualified to prescribe the particular drug for you. So like I said, it's not everybody who works in the pharmacy is a specialist. And it's not every nurse, doctor, or pharmacist knows about eye. So the eye is very complicated. So even when you study nursing or medicine, as long as you are not trained in the ophthalmology department, you cannot treat patients, you cannot tell them anything. Unless you go and study.
True. This is why even this show I cannot proceed with it without having you here. And then this is another big plus. Thank you very much to welcome you.
The steroid that he mentioned, steroids, they have two side effects. When they raise intraocular pressure, the other thing is they can cause cataracts. Long-term use of steroids. And here people are used to taking steroids. So steroids, eye drops, and even steroid creams, according to statistics. The eye drops have read a lot of statistics that says it increases IOP and causes cataracts. And according to other studies that I've read, that even steroid creams that people apply, and you know, most of the girls who are like me, dry, thin, so they want to be fat, so they take steroid pills.
Steroid pills. This is very common.
People who take this periacin.
This is very common.
All these are steroids. They all have effect in your body. So according to some studies, this can predispose you to have a high intraocular pressure. And what high intraocular pressure does is it damages your nerves.
The nerve.
So people should avoid going to the pharmacies, buying drugs, or even when you get these steroids from the hospital, when you use it before you buy it again, because I might buy it, I might go to the hospital, it is prescribed for me, I use it, it is okay, so I don't want to go back to the hospital. So all what I do, I just take the empty bottle and take it to the pharmacy and buy. But this can be controlled if the health personnel in the hospital and the pharmacy dispensers work together. Like if I don't bring prescription, there are certain drugs you cannot sell over the counter. This can help us control this. But in the pharmacy, if you are just concerned about the money, anybody who comes, you sell. Because sometimes you see crazy prescriptions.
This is funny.
I can have conjunctivitis, they give you steroid. Conjunctivitis and steroids, they don't even like parallel lines,
supposed to be used
because the steroid
conjunctivitis.
aggravates the infection.
Yeah.
So if someone who is either not trained, or you just put someone because the person is your sister or neighbor or family member, you just put the person in the pharmacy, just because you don't want to pay a trained staff, you start explaining, if you have stomach ache, give this, headache, give this, or if somebody comes with eye problem, give this. So they'll be giving out drugs. And now, when all this effect come, it comes back to the government.
Yeah.
And what comes back to the government is coming back to us, because we are the ones paying the tax.
That's it.
And it's our parents in the rural communities who are paying the tax.
So meaning people should be very cautious.
We should be very careful with what we consume, what we apply on our bodies or in our eyes, so that we reduce, because glaucoma causes blindness. And when there is blindness, there are a lot of issues, there are a lot of
and
costs.
there you spend more than, there in fact you spend more than what you know, the money you buy is steroids.
Yeah, and I think I want to add a little bit to what she said. It's very important. Sometimes someone goes to the eye clinic and they give him or her a drug, and he goes home. Someone else has eye pain or red eye. You're like, they gave me this one.
This
so
is common.
It's
very common.
So it can also increase or aggravate this condition, and then we need to be careful because it's not reversible. So another risk factor that I also want to add is the family history. That's when you have a brother or a sister with glaucoma,
family history,
or a father or mother, first degree relative with glaucoma, your chances of developing glaucoma are increased. This is because of the genetic link that she explained.
Okay.
So that's another thing. If you have anyone in your family who is going blind, you should also go and try and check.
Okay.
And see
this is another important issue he raised. So statistics shows that if your father has glaucoma, you have 50% chances of getting glaucoma.
Wow.
Both parents. But if your siblings have glaucoma, your chances are higher.
Really?
Because it's genetic. So most glaucoma cases I've seen in Gambia is from family history.
Yeah, family history.
Yeah, so we try to, that is why with Eye Care for All, we do home-based care. Home-based care. So if you have glaucoma, we track you. We make so if you cannot afford your drugs, we provide these drugs for you for free.
So meaning Eye Care for All if you trace them, after tracing, and then you take their contact, and then you know, following them.
The way we started, it was during clinics, when we see patients with glaucoma, they cannot afford their drugs. We buy drugs. Yeah. We give it to them. So we have our acquire book where we write their name, address, and contact numbers. Yeah. So when they don't come back to the clinic on their appointment days, we call them and find out what is the problem.
Yeah. For contact tracing.
Yeah. So we if they cannot come, we go to their homes.
This is important.
Because this way we can examine them and equally examine their family members.
Yeah.
Because if one person gets blind in the family, it's a burden to the entire family and the community. So when we examine the entire family, if anybody has any signs and symptoms of glaucoma, we refer you to the hospital, because we don't want you to have nerve damages or lose vision to an extent that it will affect you, affect your job, affect your family or the country at large. So we refer you to the hospital and see how best we can help those families. Because health education is very important.
It's important.
When you have all the family, because sometimes it's very difficult to get all the family members in the hospital.
Yeah.
So that is why we are very
the other thing is like the components of primary health care, or maybe we can say, and then there is another thing there, the availability, affordability, and also accessibility. Yeah. This is very important. So if Eye Care is doing for all is doing this, and then honestly I will say thank you very much for that wonderful contribution. But when am I having you in Brufut, hard to reach communities, I would love to have you there. Eye Care for All, this is very important. So anyway, we will quickly rush to the preventive measures. Are there any possible preventive measures? After that we can translate everything into the local language.
She has mentioned almost all of it. The most important thing to know is that once a damage happens, you cannot reverse it.
Wow, it's irreversible.
Yeah. So you need to catch it at an early stage. That's why their job is very important. So if you catch the disease at an early stage, there are things that you can do to slow its progression. And if you sometimes even stop it. Yeah. So that brings us to the management of those with glaucoma. Yeah. So there are drugs that can be given to lower the intraocular pressure. There are a variable amount of drugs that you can give. There's also some laser treatment methods that you can do, or surgical methods, like she explained earlier. The trabecular allows it to pass. So if you remove the trabeculectomy, or you open it, trabeculotomy, it allows the fluid to drain.
Yeah, to drain.
So those three methods are the ones used to control it. But as of now, there's no way to actually cure someone with glaucoma, unlike other diseases like cataracts.
Okay. So, madam, do we have any strategies that you do with the community or with the people in the country in order for you to reduce the progression of glaucoma?
Yes, so like I said earlier, with Eye Care for All, we are more concerned with the preventive aspect, because government cannot reach everyone.
Yes.
And this is the little we can do for our community, because we can sit down and see everybody around us getting blind. And so glaucoma, blindness from glaucoma is irreversible, which means if you are blind from glaucoma, it's permanent, it's forever. You cannot see. You cannot go anywhere in the world where you can have surgeries that will help you regain your vision again. Nowhere in this world, not in US, not in China, nowhere.
It's irreversible.
It's irreversible. So that is why we go out in the communities to sensitize people, tell them how they can help themselves and their families. So I would just want to make this clear to people out there. During my practice, I've seen many people who come with glaucoma. When you put them on treatment, the misconception they have is whenever you are taking drugs, it means that drug is going to cure you. Glaucoma is a non-communicable disease. It's just like hypertension, diabetes. Once you have it, it's a lifelong treatment. So with glaucoma, it is not curable. You cannot cure it. It's not curable. It's treatable. Like we can manage glaucoma. We can manage the intraocular pressure to put it under control. We can manage the nerve damage to slow it. Even if we cannot stop it, we can give you drugs that will slow the nerve damage. At least that little vision you have, you can live with it for the rest of your life, so you can continue with your job or your business or with whatever you are doing. So we don't just want you to get blind. So we have different types of management, like you mentioned. We can do medical management and surgical management. So with the medical management, people have two options, and it's very important for health workers to explain clearly to these people the advantages and the disadvantages. So the medical management, when we put you on treatment, you have glaucoma drugs that control the pressure, and we have drugs that are readily available, like timolol. When we give you that timolol, we ask you to take it 7 a.m., 7 p.m. twice a day. If the timolol fails to control the pressure, we brought you on Diamox. That is, if the pressure is very high, above 25. Some people come with eye pressures like 35 millimeters, which is very dangerous to the nerves. And they have severe headaches. So if all those things fail, we put you on Zalatan, Latanoprose. Those are very expensive. With timolol, you can have it at 150 a bottle. And this is something you have to continue using for the rest of your life. Imagine an average Gambian or someone in rural Gambia who has to buy timolol, $150 every day for the rest of their life. And if that timolol fails to control their pressure, you have to board them on Zalatan. And Zalatan will cost you $1,000, $1,500. It depends on the brand. And this is something very expensive. We all know an average Gambian, even in urban Gambia, who is working, cannot afford. So that is why people default when it comes to such kind of treatment. So the person will use it once, twice, they cannot continue. It's expensive.
Because, so they see that it's not improving. It's just keeping what is there.
So if they don't understand that this treatment is not to cure them or to restore their vision, so they default. They will say, this is not working. But the fact that you tell them that this is just to help you control the pressure, so you will not get more nerve damage, is very important. So this is very important when it comes to, when you are dealing with people, less privileged people, you know they cannot afford this kind of drugs. It's good to advise them to go and do glaucoma surgery. It's optional. We don't force anyone to do surgery. But when it comes to cost effectiveness, it's better, especially in our setting in the Gambia. So with the surgery, like you said, they do trabeculectomy. So because the trabecular meshwork is blocked, the angle is blocked, the aqueous is not draining properly, you have high pressure, that is where the surgeon will have like will create an opening, another opening where the aqueous fluid will drain, will pass through. So the pressure will be under control.
Okay.
Surgeries do have their complications, their advantages and disadvantages. It doesn't mean if you do surgery, you will not buy drugs again. If your surgery is successful, you are lucky, you will not be boarded on drugs after recovery. But sometimes we have patients who are unlucky after going through that surgery, the surgery fails or the angle gets blocked again, you have to put them on treatment. So it's complicated. Patients need to this is why counseling glaucoma patients is important. It's important. Counsel them, let them know the options. And,
the
but
prognosis,
recently there are advanced treatment that is out. People are working on it, and in the Gambia, Cesarite is also doing it.
Yes,
and for Gambia, we are lucky that every health center you go to in the Gambia, major health center and hospitals, you have an eye unit.
Okay,
this so you can easily
is another added advantage
for your eyes.
Thank you very much. Badi ngolo komi nga fali nyaming kacha nyinto be kacha kamin na wolong nyakulo tara malaring bari bukeje mandin kol ntol bota tundol min kangol ka fala wulundim fincho mari nyaay tara betiari ngi tara jero to ila jibero to bara bikeje kurangol ma fanati adum fana mo jamala fincho ila jeri balia sababu molti woto nil lalumol be siri min yalan ko etol mul lonnal leti adum nyin karola ye londo soto jele ni wala sirin ka kacha bari kacha kadia kumatiyo fangol da kono wala man ni ngol safa chokore kadia wolo fangol da kono woto sa koronto kaf mole ko muna nyenti adum mune ka sababu adum fana sa tamanserol fonye woto nga kumota kumatiyo fangolu madamo ya koten ke jandi me munu nanna ken duma muna mu nyinguli ndim finchote tubabul kaf me ko glaucoma
mbading gibe lalu ndele mu Fatmata Kasama nkabonang IKF ko all kafole to so bi nakacha be kacha la wulundin finko sasa la so wulundin finko comme jaaju ya fo nyamen doron nya kurangole me alonko ala nyala fasul aka wolle tinya so imari janni abe fasul fawlo tinya la imari nyaka preso le soto tension aje baloka preso soto nyame nyafa nan ka preso soto wala nyame so amanke ko ni ko nyala preso seleta anim balola preso selo manke kelenti so nyala preso ni wo seleta atata fos tembo men ya lon ko nyama o preso nyin marano so ibaje la fasol tinyala na fasol tinya ila jero be talala la jero ka talala domandin so nyin sitano le fo sanji tan lulu sanji muang janita mariba kalamuta dul kata le foy siyo dandula ita fonko ni faso la tinyate batande bari jama ni faso dati takatinya baje la ko ni betamala fengo fembe karatantango isa tama no le tari fadila ita kalamuta la molta kalamuta la wala mol samira fango be tawkanne a tarako imantara o ma fangol jika wala mulundim finko la fonko taman sero tida
okay obeti ada bake kendingo ngamere fana bala fla ka fel la faje mimbo taman sero to tubabul ka me signs and symptoms ko fo nyingulundim finko fana kol soro no because ngamera nim moy sutero keno taman sero la kaminke mo bala hanata ko mansia kada bakilimo ko no sitano loptano to pour que tankaro nyini je wala jaralo wala kiskisiro nyini je ngamera taman sero bala ba
so taman sero mingena siata ñing muli ñing sasa ñing soto wolong ika finkila ni la finko ñing ka commencer nin karaden dangol na ñaato
ila jero buka bete a karaden dangol
ando wulundim finko sasa sifa jamal le bakoto sasa sifa bi je mi alan ka dindingol muta ina ka wulu wol ika fo tubabul ka fo mi congenital glaucoma ando wol ni wol soto ila nya ñing ka gëna wara la fingo ñing ka gëna wara ando lampo ni lampo je ibuka la fi lampo jibe la wol sekene o dinno ngol kon bar kebal to min gena kumayata je wolon ila finkoti min kana danka an mi alon ko aka bonan karada na leta kana nyaato min kamin je nyul kono wolon aka tara kebal le kono wol mi alon ko ila sio tambita sanje tanani la bar o matina buka buka mobi aka mobi mutan wala bara siata wala kono kis rofana je ko lonna dol ka fa siata kin le kono dol ka fa siata musul le kono bare ase mobi mutano okay an fanang na je ko nyin sasa siata mo fingol la fanang gena kono aka mo fingol le gena mutano an fanang nyin sasa la franka do fana bije ka fa mi angul close glaucoma o mu emergency lati o mu sasal mi alon ko aka mo boyndino tariake mo nyin kana nyaka dimi aka fono abuke jino ku o be kana no dula sutungol to bare ala e mol dima nyin sasa ala nyin sifa o man siya ba ka kontrol la nyin tundu
okay abaraka ba ke kendingo kumo seneata mbe murunda madamo kanko danga because bi nama sabar nyobala de bi kanya senelon set mol yalon mimba keri bayri nyin ngaji ko komi mojo mala finjo courant kotengol ko la ta fana dabla ta je bake so nsafo mole ko fo risk factor bi yela mi anko ka fo sababu kol bi yela mi anko asa keno moy nyin wulindim finjo nyin soto ba
sababul bejele comme nga fa nyame nyin wulindim finko amanke ko mol ya foy ko ni nyin keta wala ka nyin ke ha comme ça fo ko ni ko malaria sifa ni susula ye
fentije mi ankon ka kere ko olbe loring min ka sabu
wo man soto ani san kisi robe kerin ne wo man soto bari ndung ni mo soto ila family to ini men wuluta ina denta sa koy ba may fama do ko may koto man ni me ni wulundim fink kurango soto ita fanan isa soto nol ma foko iba soto la bari fanan sa soto nol men gena koy tan yemu soto la family to me ni sa soto yete nya check yeta jibe
l'hôpital to
ya jibe mol men yalon ko ye sanji tan nani soto kata santo jama wolle ka soto bari wo mati na modol ka soto parce que hani dena no naka wulule menu ye sukur kurango soto ani yele solo wol fanan ka soto le ni ajibe comme wala chance pour ya soto wala ka gena sia mo me yalon ka man sukur kurango soto wala yele selo ha
okay then wo kumo seneta bake woto mbe tenten na bari tankaro wolen sindi jang nganyumi mfango be fo tankaro lo kumata bake Mosa fango tankano nyina nyaming badi lamo lal alnal badi malong Ahmad Abdullahi Jaju wal katara siringa le jang Hellstar toyara tumo tumankal lumol le sindi bari kumo ka karla fonye kuma tiol fang kuma di sindi ya nyinka saing fo ferel bije bang Mosa fango tankano nyina nyari kuma tiol alwo fonye bang sene
coming Fatmata ya fonye men sasa lo mi alon ko nata ta fa kuma sita abuka jarano abuka murunno kuma nyani dulamin bukaje fereti je mi an ko sakino
pura je ko tanke
so mingena kuma yata nyinto wolon kata loptano to juna eta loptano to jibero ke ne jibero ke salon ko nyin sa be lale ye borol di la mi yatina mbatina la sa nyinta gena wajabela wala gena kuma yata nin sa nyinta anon tol be Gambia tol na alatentu bake ka do loptan babu janne mi yaron ko ika nyado ko ke organization all fanam bi janne min kata comme
I care for all
mi yaron ko ka bulamol kono satel kono
ke sembentu yandi
ika in londo digala wala gena kuma yata ning wulundin sa la tankan bi
muna ferel balaringal bulbang I care for all adum fana felenga nyateling biko nyina mi alan ko nyin glaucoma ate abina jural fo ferel balarin je bang min alan ko mo sa molu sementu yandino pour que fanga tankanyina
I care for all tel sang nka fintile ngamul nyal jibe nka wokele free ko mo charge fenna nka mul free dia glaucoma soto le bang fo woto nya problème bila ni soto ni nga boro ni bemol bulu nga dila ni boro ni temol bulu nyanta tala dame docteur o min nyante jela wala l'hôpital o min gena sutiate nga lon ko nya do kula beje nze kayto safeye ni fenke yeta woto bari intel AKF o bir nga lon ko l'hôpital to de amanke mobile katano je sakora me ya lon ko be santo to iyabe jamfaring lopitano la wala man paso soto wala lanjurata wala sasata black nan tel kata sata wol kono nka dum suwol fanan kono ka mol jibe bari nyina nko because ninta ta birkama ko doron nebe na fonko na fa soto sa nyina nko mol bita radio le to anin telel to
television for wider coverage mo
jama balon na munne munyi ngulundim finkoti aka munake anin mul sem fan tankano menna so comme ñing kayto natalo membe mbulu doron nte nimbita dawo dan kan
natalo beti ada bag
nin tata santo to ye fengo fo moya moy anayaje imanke killing so ni ko wulundim finko aka ke fonkolti problème o me alon ko aka nyala faso lektinya sign comme ñi ñaateng mo kilingo le mu ñaamo ñintide parce que wulindi finko ñing ase mo ñaa fulo be mutanole ase mo ñaa kilingo mutanole ase folo no ñaa kilingo tole na parita ta ñaa fulan jangoto al jibe la menu be jibe ni me ñin jibe iba jela ko ñing abe amang hani problem soto ibe fasol jela fasol be bete yare andin dulandin ne be je damento yalon ka be aneta mun kumulunta ñing jem mo ñaa kono wala mu ko mo ñi may ñaa abe beteyare fasol be beteyare ni yelol be takanga nyama nyakuma bebe ibela doko ke kay nyama e baje ni wo mari comme ninko ni misare fe ni nya a nyakuma ni ajibe e kanyine je a bebe beteyare ni wo mari e dula jibe ala jibe jero bebe sene ala bari mo me yalon kay glaucoma soto nya fasol tinyata amanta l'hôpital to amari sita fa finkita suwo kono because jama ni mol bina l'hôpital to ka tarale e finkita wala e nya faso beti nyata ni nata dol jama mol sa foy ko isi nalen wala ini members konyo kilo kan al sonkata wala e doku atara wante inyala faso letti nyata ni tata morol ya ye la ko do domo ye nasol di la yake nyako inyaka gana tinyala mengena koyte yeta l'hôpital noto parce que ñin kurango na ye muta ama jaral soto dunia dawda tata je jaral teje so e baje la ko ñing mari ñinya ate wulindi finko soto anya fasol be tinyata ni ya mari nya ko ma jibe e kaje ten ñin dula même bebe wulere a be set sign aneta munkuta akamuta le fala fasol be tata
be tinyata
ñin fasin dingo men tutaje wala tinna amari ba ñin yiru sungo fango jeka ñin yiru sungo dandango la menu bebe je ada findinne akamuta fasol menu ka atina marie ñin ma fango je wol fasol be fatale sa ñin demande ngo men tutaje ni ñim fanam be tinyata e baje ko jam bebe neta mun kulal ni jam be neta mun kuta akamuta ni o mari ni nya ay ñin yiro jibe dula bebe talla dibirin so wala ne ko ñin wulndi fin ko e mari nyaabe talla jibe ro la ibukeje jaral tala mengena koyta l'hôpital to dum mote jibe la no dorong aya foy ko ñu wulindi fin ko kuramale be
mo buka soute no mo bala
hani foy sita l'hôpital to ye nyako no jibe dunga manke ka nyaala nyaato to doron jibe parce que nyaae ay pat jamale so nyaato be jele anin koma foy se koma jibe façon ni façon jibe ibaje la ko be ibalo fo façon tinyatale wala pour glaucoma ti imari balon docteur o nyinga balon na fo yele selo be lale fo sukuru kurango le be la ba hani HIV isa je no nyakona hani bring ibola fenketa ibola wato isa person o nyin diagnose no nyakona so nyamu fenneti me alonko kuran jama se je no jele so mengena ko eta glaucoma nyewulu dum finko man jaral soto ika boro nyin tale doron foy siyo dandula wala operation oke men koyta moy ta ye nya cek a jawyata nyawnya sango kono sinya fula mo nyanta tale ye nya jibe ni wo man keno at least sinya kile bari si sanji tan saba sanji tan nani ngana me nya cek si rek no kile ye finki ko ye jokule
anim foñole benta wala
dinole mum seytan wala atarani seytan
adorta dabarolo kan sifal
akara nya fasole ni wonten ite ibe junubo soto la e ni isi nyole yela ko do men be soto ita be di morol ba sannemu ni so sannemu ko do dinala atara dara faso men tinyata nim faso na tinyata banta tubabu do america lem wo china wo itata dawo day buka jarano gambia kamen keno ifanan ka wala keno wodoron nem so mo ke pour mo ye fantanka yeta l'hôpital noto ye nyaajibe wo damale akumata baka baraka baka kumo senera foy fana be kumandim fayla mol kam pour yela miral nya l'hôpital bunda la karola wala nyin l'hôpital jaralo la karola ya falino nyamen pour sa nyin courant ala sele nya nyin jindino banko kan nyamin pen
nyin courant nyin asiata banko jamal le kan dunia ko ni dunia ko no jibe ni be contrôle min ka gena mol finkindi ding di sasa long fulan nyawat ning katarak buta jatal kagena mul muta and then kikistro ya jeko asiatan tol ani mufindu ani moving on
yes
wala na kuma eta bakal sako banko mi alon ko do mansia banko mi alon ko mola balunya ka koli akol akuma eta bakal pour clean na mayo bulaji hani be do ko la ya do bulaji eta loptano
yes
nira loptano te mante baramala e mante nya yelela ebe masingol leta damma e manta fembula li nya kono e ba jibe lek preso ni nya yo ko mo jamal mi wulundin sa soto e la nya kono preso kas aka sele baket pourquoi preso ni jibe e ka masingol la ni nya to ya jibe way preso ni calculate ya fo nyinom preso a seleta la wala do ya
la okay
do fana bi je min ka nya kono to jibe wo be man jare ibuke nya barama ibuka
fenke ha so wala ben timinandi yani bunya ni horomo aka bede abakala komi
même ko dol fana bi je mi alon ko inyanta traila le eta loptano to nyaaji wala ngadin drive wala mol mi alon ko kanyum machine do ko mi alon sa ko nambarano because nin drive man tara karada nangol je kan wo kala problem ba to man so drive kibal mol be dal atata loptano to
at least komi madamo afanya mi sango kono e kana si fo sango e bang e manta inya viste wala ataste maybe asikeno hanna manke fulati wala killing ya long exactly mona ba caring jandim be nyote sila
sakoni ko ma soto wala kotoma wala fama wala badin sutu ko mian ka nya problem o soto
mi anko ya soto
jaju me kuntu ni be para ni tata lopitano tiketo e ko dan mala sa monen lulu ni tata nya lopitano ni monen lulu san tiketo e be nya jibela tesla ya jibela nyala jiro danta dame ye nyala preso check ye boro ke ay nya parantero yele ye nya ko ma jibe be moane lulu odo du ni dala dula dol to moane lulu tebulu tiketi songo tebulu ibakele ndal ni nga ndata sata wol to ko mo charge fenna ndal kafo dingol le ka kafu nyoma nga borol sa nin tata nga nyaal check ni man yalon ko courant ni soto nga boro dila so dol be je fan government l'hôpital to ka boro dile na soto tay ka dile comme ka mol menu kata l'hôpital to wala siata ka je mobe bu ka soto no so mol kana mira ko ni nya chego pour kata l'hôpital to be chat la ko di jamal ni men tata l'hôpital to be tiketo dama sanam wani lulu ye nya ko no jibe ni tata do re sa fon nafta nya jibe la fo glaucoma pour ñu wulundum finko glaucoma iba be check la because kanifing l'hôpital to sezai ni tata je ila triage momon din tambita wo triage la ike comprehensive la ke comme nya biring bantala fokonoto ika bele check ni aje ko problem ding beje docteur o men nyante je la e fonko safe appointment no safe pour wo yeje ni fa do fana ya kis role men ya lon ko yi sola tala wo fana do kis role fonko safe lay pour ye walke so mol kana mira ko nyin ulundim finko mol ba foka nyamen comme ebe ko di jamale joda wonte
no ka monta komi monni lulu yanjing tasterol mini beketen woda soneta bakala woto badi ngolo mbal advice la lamo la nyimal mbal advice la pour alkata karaba kilin alkata loptano to pour tastero kadu nyaku mbata baka harmane wal balu konal ni tra ko la jero dasata ila jero nasita aka kolea bakale because akarna diba do ko nyibula so because jero wolon do koti nin jero dasata jero nasita ni tamu dry food ita dry food kala ni tamu no sorry ita no siya kala katu nyanta bol pengula bila borol bi nyanta fekala ibu kolje so akabon ko sang mfelem bila programo nyim fala ku fala so kubala ba mi bal bolo pour ka fo mole banta albe mol las kumol ro pour ka mol nimbara ke tentu.
Okay, so I think I'll give my last remarks in English. So the most important thing about any condition, especially in our region, is to try and know about the condition and prevent the condition before it reaches an irreversible state. It's most important with these non-communicable diseases. So the non-communicable diseases, they are diseases which develop over time. So glaucoma takes 10, 15 years, 20 years before it comes. So there's a lot of time, there's a lot of chance that you have to prevent the disease before you get blind. Same with diabetes and hypertension. And these diabetes and hypertension are also linked to glaucoma. So it's important that we try and prevent the diseases before they reach.
So meaning an advice for people to endeavor
to go to the health center.
To go to the health centers, health
like,
facilities for screening, proper
people
screening.
like waiting on their diseases till it's too late.
Yeah,
so just go to the health center. How many Gambians go for a comprehensive health checkup every year? Like, it doesn't mean that if you're not feeling anything, nothing is wrong with you. Just go and make sure that everything's fine. You just take a few hours of your time go to the health center, check your eyes, check your entire body, and make sure everything is fine. And try and do that every year. It will really help.
Because early diagnosis, partially the treatment. Yeah, early diagnosis is very important because there you can use another preventive measures to reduce the progression of the particular disease condition.
Yes, so I would just say my last words in English, just to highlight some important things. So I Care for All, it's here. We are a not-for-profit organization, charity. We all, whatever we do for free. And then whosoever is available to partner with us or to support us, help people in the community. Because personally, I'm passionate about eye health and how to prevent blindness in our community. We know what blindness is causing. So with I Care for All, we cannot do this work alone. We are trying to just contribute our part because we know government cannot do this all. And then people in remote and neglected communities also need these services because health is a human right. So we partner with a lot of communities. We've partnered with NGOs. We've worked with staff like cataract surgeons that are in different government facilities and with the National Eye Health Program to get to where we are today. And then one important thing is glaucoma causes irreversible blindness. And then it doesn't mean if you are blind that is the end of the world. So there are also rehabilitation facilities available in the Gambia for people who are blind. So whether you are an adult or you are old, you were working or not and you happen to become blind, it's not only glaucoma that causes blindness. Because with hypertensive retinopathy, diabetic retinopathy, you know, can all lead to irreversible blindness. You know? You can have retinopathy of for kids, prematurity and other eye problems that can cause permanent blindness. So we have GOVI, it's here, that can help people who are visually impaired to go through school. You know, you will learn how to use the braille, and in later they will incorporate you to mainstream school, so you can go to schools like any other young people. So being blind doesn't mean you have to stay home. And we have we work with one organization called Start Now. It's in Brikama. Their office is in Brikama. The founder is called Aliu Jete. So Aliu is doing an amazing work. So what we do is we try to partner with them. So whosoever is watching this and you have someone who is blind in your community, especially when they are young people, they can go to school or they can walk, you know, you can refer them to us or you can refer them to Start Now. So Aliu is visually impaired. So he trains people who are blind how to use computers, how to use smartphones. Because if we have this, they'll be able to go back to school, you know, they'll be able to go to get a job. Because if I am blind, I can use a computer, I can work in any office as a secretary and other. So currently, one of the organizations that I work with, Prospect for Girls, we've opened application to recruit people with disabilities. So whosoever is watching this and you have someone who is disabled in your community who can benefit from this, they are 18 to 35 years, they can contact us, Prospect for Girls. So we are training them on food and beverages management and also the blind people how to learn skills and then go back and work in their communities.
Okay. Ala baraka bake badi ngolo alnal badi malang Ahmad Abdullahi Jaju atau bina muru nalela loko ka jarekenda ki waro soto health stars wolle siso kon ka siala jang ala baraka bake.